With that, we'll move into the next talk. I have the pleasure of introducing Dr. Rena Szabo. Dr. Szabo is our psycho-oncology section director at the Banner MD Anderson Cancer Center. She's a health psychologist who specializes in behavioral medicine to treat cancer patients. Dr. Szabo she achieved 2 master's degrees before earning a doctor of psychology degree from the Illinois School of Professional Psychology. She's also achieved the honor and award of an integrative oncology scholar by the University of Michigan, go blue. Dr. Szabo specializes in exploring the biological, psychological, cultural, societal, spiritual, environmental factors of life, and how each of these affect physical health and the quality of life for cancer patients and their family. It's my pleasure to introduce Dr. Szabo, and she will take it away. Got to unmute.
Sorry about that. Thank you for that introduction, and thank you, AIMS at Melanoma, for having us here today. My role is really to discuss how the person is impacted by a diagnosis of melanoma. We come into this hospital setting, we go through the waiting, the diagnosis, the treatments, and the whole time we're focusing on this disease. And my role on our multidisciplinary teams is to make sure that we're taking care of the whole person and the family system. Without doing that, I don't care if we treat the melanoma successfully or not. Essentially, you have somebody's human spirit that is neglected during the treatment, and at the end, that's broken. So it's extremely important to start out your treatment with addressing the human side of your soul, your life, your family, your support groups. And I have an issue with my wonderful computer, so Beth is going to pull up my slides because they're not coming up on mine. There we go. Could you put that into the presentation mode, Beth, please? Thank you. Okay, so please bear with us. We're going to work as a team, which is pretty much what we do over at MD Anderson. So my next slide is my disclosure slide. I have nothing to disclose. And moving on to the next slide, it's not just skin cancer when it's the largest organ of your body and it impacts your body, mind, and spirit. Melanoma is a longitudinal disease. We have many individuals who are diagnosed earlier and they're living longer lives. And those psychosocial issues continue along that entire survivorship journey, right? It's going to contribute to how the person sees themselves. It's going to contribute to relationships. It may impact how a career is changing or moving. So psychological distress is really the most severe at the diagnosis. At this stage, I often see that patients experience a high level of distress about death, fear, dying, and concerns on how the treatment might impact their lives, whether it's professional or personal, and their families. This is a time at diagnosis where psycho-oncology interventions really play a huge role. And the reason I say that is because how you manage the stress or distress that comes with a diagnosis is how you will manage in the future related to any disease process, specifically to a recurrence of melanoma. So figuring out how to manage that stress at diagnosis, not waiting for it to escalate, is more important than we ever knew. We know that individuals who address that stress and use positive coping strategies, behavioral medicine, psychological support during that time frame, initial diagnosis and beginning of treatments, they actually have better mortality within the melanoma disease process. During treatments, though, sometimes patients will have more anxiety, very similar to the anxiety that occurs while they're waiting for diagnosis or waiting for results. The treatment process, as you've already heard today, is varied and it's very individualized. And sometimes when you think of treatment, you think of one experience. And as you've heard today, there's many that are tied together for this comprehensive care. So every time you hit a new form of treatment, there may be a possibility of an increased distress, stress, anxiety. Many times we see people really kind of isolating during treatment because time has gone by. They don't want to burden others. They don't want to continually talk about it. As far as the family members, they are also in their own little isolative times during treatment because they don't want to burden the cancer patient. Again, though, these are the moments of change where that increased stress is, okay? And we can go on to the next slide. So specific to melanoma, approximately 30% of the melanoma patients report having distress and stress. And it's not just daily stress. It is truly more of an extreme clinical process that's occurring. And we now know that the cancer patient's family members or caregivers or support team, they report almost similar levels of distress. Additionally, both the supporters as well as the patients report increases in distress, stress, anxiety, negative impacts of the melanoma at the same times, whether it's recurrence, treatment, initial diagnosis, or long-term survivorship, as well as, end of life issues. So that's significant, the practical, the social, emotional, the psychological demands that go along with this disease, just couple with the physical effects of all these treatments. So it really can change an individual's life, right? What I am looking for is how is this diagnosis impacting your reaction to your self-identity, your self-esteem. Many times after surgical interventions, it might be a body image. It may change a perceived understanding of well-being. Some people, when they go through a diagnosis of melanoma, definitely make behavioral life changes. And others say, well, you know what, why even try? I already have this in me. We have family relationships and roles that change through this, lifestyle functions and behaviors. One thing that we don't talk about a lot is the impact on sexuality and how that impacts quality of life. We've got the finances certainly do play an impact. And also, how is this going to impact my career if I'm a cancer survivor? Is it going to limit it? That initial shock and fear really dives deep into all these areas. And then you add on, there's some significant toxicities with the treatment. And so a lot of times we think about the here and the now of the treatment and the here and the now of our diagnosis, but the ongoing impact that it may have, whether it's visual problems due to one of the treatments, whether it is neuropathy due to a treatment, whether it's cognitive issues that are longer lasting, whether it is anxiety. I mean, there's quite a few leftovers that can impact our patients long-term, even during long-term survivorship. So when we think about the distress that may evolve, and again, 70% of individuals with melanoma do not report such, but 30% do, right? We know that if you are having any distress, that you're more likely to delay treatment. We know that your medical costs are likely to be more. We also know that, your quality of life will be poor and your ability to adhere to whatever the treatment protocol is not going to be as good as it could be, right? As far as any kind of preventative behaviors, those are limited when we really focus on the stress versus the quality of life and living. So why don't we move on to next? Thank you. So one of the things I talk about with my patients quite a bit is I think the hardest part right after diagnosis, and maybe even leading up to diagnosis, is the waiting. Nobody talks about the impact of waiting when you're diagnosed with cancer or when you're diagnosed specifically with melanoma, right? That waiting time where you're sitting in your own head can really cause a lot of uncertainty and very much continue to feed more and more stress with those different types of questions that circle in our brains, right? You know, one of the things I want to point out is the connection between stress and cancer. So when you think about stress, we have positive stresses, we have physical stresses, psychological stresses, spiritual, we have negative stresses in our life. You know, some are good and some are not so much. Problem with stress that's negative is that when it's constant, our cortisol remains high most of the time. And when the stress response continues for a long period of time, that constant imbalance, it can cause physical damage. And we've seen that specifically related to cancer and melanoma. And over time, the delays in the restorative repair in our body that should be occurring really pushes our bodies to the brink and allows things to creep in. And that's where that pre-disease state starts. So think about what Dr. Gamble was saying previously and speaking about the incidence of melanoma in relation to early on or early life environmental factors. So you have that, and or you have a genetic predisposition. And then you are dealing with chronic stress. When your body's dealing with chronic stress, it is completely not paying attention to anything else in your body. And as that happens, it allows for gaps to occur, which are these pre-disease states. So people with melanoma, when you think about this, that incidence is higher with individuals who are in stressful situations and also who are immunocompromised. And you might not even realize that's your situation. You may have no idea that you are immunocompromised, but you possibly are aware that you are dealing with very stressful situations in your life that are chronic and ongoing. So what we found, though, in some of our research is that melanoma's diagnoses briefly relate to prior stresses in the year before. So it's something we don't necessarily talk about when we go in to see our oncologist, but when individuals come into my office and my team's office, that's what we're looking for. What has been going on in your life? And with cancer diagnosis, you have a choice. You have a choice to look in the rearview mirror and see the things that served you and the people you love and bring those forward on your pathway and journey. Or you have the choice to bring the things that didn't serve you forward. And so this is an opportunity for us to work together with the family and the patient and say, what didn't serve you? And if it didn't serve you, it was likely serving chronic stress. And we know there's a correlation between that and cancer. So how do we make that change? We talk about behavioral changes and psychological changes as you move forward in melanoma. But we talk about those behaviors, the sun behaviors, that type of thing. But it's also these types of behaviors that are extremely important, right? So in melanoma, there's some evidence that the stress is leading to this dysregulation of the immune system, right? And these hormones, there's stress hormones are varied, but there's one, norepinephrine. It has been caused to show an upregulation, which predisposes people to various disease states, but specifically melanoma. So those stress hormones need to be managed so that they're not chronic. They're only supposed to be there and to be acute. They come in, they put out the fire, and they're supposed to leave. So when you take the environmental stress that appears and factors and the genetic factors that appear, and then the chronic stress, you have melanoma, the formation of it, and the progression. So what we want to definitely do is not create that gap space moving forward. And the reason I put all of this out here is that on day one, you are completely a part of the treatment team at Banner MD Anderson Cancer Center. And so one of the ways for you to be empowered is to say, I'm going to go here for my immunotherapy. I'm going to go here for my surgery. I'm going to go here for my genetic counseling and my testing. But you also can go inward and within your family system to make these behavioral changes, because managing these types of things are just as important as other interventions if you want to treat that whole person. Next slide, please. Thank you. So sometimes people will say, you know what, you assessed me and I have no anxiety. I filled out that little screener. I have no depression, I'm fine. And so something I really talk about with our patients and our families, and even with my colleagues on our multidisciplinary teams, is it doesn't necessarily always look psychological in nature when you're looking at stress and distress. I mean, there's many physical aspects such as increased heart rate, trembling, sleep disturbances, hypersensitivity, fatigue, headaches. Those can also not have a disease-based indication, but more of a stress-based indication. You know, when you look at some of the cognitive stressors, I've seen many patients and even family members, you know, struggle with poor concentration during the journey, you know, difficulty calculating things, sometimes forgetfulness, or, you know, irrational thinking. Decision-making processes are impacted. Problem-solving ability is impacted. And then we also have the behavioral types of stresses. Like, are you seeing anger? Are you seeing withdrawal? Are you seeing an increase in drug or alcohol use? Maybe there is a little more irritability, sleeping changes, emotional discomfort, suicidal thoughts or processes, maybe even absenteeism from work or from different activities that one was involved with. Maybe all of a sudden there's huge relationship problems that are seemingly coming from nowhere. So those are the things to notice in yourself and also the things to notice in your loved ones. Next slide, please. Can you go to the next slide, Beth, please? Thanks. Okay, well, I am going to keep talking because I'm not sure if she has the ability to do it.
I'm sorry.
No worries.
For some reason it's stuck.
No worries. I'll just keep talking. So there's been a great highlight in the last 15 years of my career on caregiver stress. You know, we always seem to focus on our cancer patient, right? Or our patient with cancer. And sometimes forget that they do not live in a vacuum, that we're all relational and dependent on each other. And in fact, that's extremely healthy when you're going through cancer in any part of our life, because one, you are more connected with loved ones. You have an increase in oxytocin, which is actually neuroprotective and an anti-inflammatory, and actually helps your body fight the battle along with you. So caregiver stress is real. Burnout is real. Nobody wants to talk about it. It hits you when you're not looking, when that wall gets hit, right? But it's something to start discussing day one, because no matter what, that person with cancer or that person with melanoma is going to not want to burden loved ones. And like the same goes for that caregiver or that loved one or that support person. They are not going to want to burden the individual with cancer with their problems. And so as time goes by, people tend to go into these little silos, and it is negative for both individuals or all individuals involved. You know, some of my patients and caregivers have described concealing a lot of their psychological concern or distress. They kind of try to put on a brave face around the people that they love so much. And keeping it all stuffed in, afraid to talk about the impact of melanoma on their future. There's other additional sadness and grief and loss processes that even if it is not a terminal disease process, that people are going through because of the change of roles. A lot of my caregivers and family members have kind of shared with me a theme of feeling devalued over time or taken for granted of. However, they're not comfortable discussing that. And that causes a lot of stress in caregivers. Some caregivers speak about feeling very inadequate. One of my biggest take-home points for this is, though, that there is some evidence to show that the poor coping mechanisms and communication that caregivers use during the cancer journey is a prediction of their own health outcomes, no matter if the patient is successfully treating the melanoma or if it is a terminal disease for that person. Next slide, please. And so at Banner MD Anderson Cancer Centers, we are completely committed to really looking at that whole person comprehensive cancer care, whether it's in tumor boards, whether it's in grand rounds, in daily huddles, between team members, in different clinics. So if you don't touch on that at the beginning of your cancer journey, your quality of life is going to be impacted, right? Your spiritual, social, cognitive, emotional, ethical functioning, financial, it's going to really weigh on you throughout. There's some studies that show that individuals who have psycho-oncology interventions early on and throughout their treatment end up having a reduced risk of melanoma recurrence and a reduced risk of death. So linking this into and plugging this into a treatment, again, alongside with the rest, is extremely important. When we look at the body, mind, spirit, start thinking about what are the behavioral changes needed, as we kind of mentioned before. Looking at how life needs to change as far as your relationships. So let's go on to the next, please. So I put this in here because you have a choice when you're diagnosed with cancer, right? You have a choice to hang on to hope or to hang on to despair. And no matter which way you go, you will become anchored in it unless you open up your paradigm in order to challenge the other side. We know that individuals who can categorize their perception and paradigm from a hopeful state have better outcomes. So when diagnosis comes and you do have that choice, to me, that is difficult. It may not always feel right, but hope is something to think about grabbing onto and anchoring yourself to, because your quality of life will be better. And I love this saying right here, hope is a central emotion, but we're often at a loss of how to define it. And what I love is that hope isn't about Pollyanna. Hope isn't about, unrealistic positive thinking. Hope is the underlying foundation, right? It's an experience that we have a choice to grow out of and behave out of. So something to keep in mind. Next slide, please. So you and your support team have a choice, right? You get to survive or you get to thrive. So many patients put life on hold when they come to me. I'll hear statements like, oh, when I'm done with treatments, or when, after this next scan and I'm clear, then I'm going to plan that vacation, right? Or when I'm cancer-free, I'll do ... or we will do ... What I challenge you and my patients is to every day choose life. So no matter what the weight of this disease is or the treatments are, there are 2 commitments that I encourage everyone to adopt. Live every day. So when your head hits that pillow at night, reflect on that day and go, you know what? Maybe I didn't feel like I was living those 10 hours or 12 hours, but here's one thing I did that reminded me of life before cancer, right? And life is before cancer. I mean that holistically. If you put cancer before your life, cancer wins, right? So choose to live every day. And it may be walking to the mailbox. It doesn't have to be huge. And then to every day, remember that as you're choosing to live and face your cancer, wherever you're at in it, do it with the thought process or the paradigm or the perception or vision of body, mind, and spirit, right? If you don't actively engage in nurturing all these facets that we have, whether you're cancer-free or living with that chronic cancer, the neglect has such an impact that is negative on us that is something you can do every day. If you don't do it every day, I don't care where you end up in your cancer journey, your spirit will be flat and you'll end up feeling empty. I always try to say to people, you are not a cancer patient. You are not a melanoma patient. You are a patient with melanoma. This is my loved one with melanoma. Never, ever put the disease before the person. Next slide, please. So this is just something to leave you with, be empowered. You have a choice to be empowered. And if you are already on this journey and haven't, think about this, think if, maybe you can take a shift. It's not easy to shift sometimes, but that human spirit is strong and there are miracles that happen. And when we say, oh, I'm looking for a miracle of cure, certainly that's ideal. But there are other miracles that can happen on your cancer journey. There are areas of our life to explore, to figure out what is your purpose, what's your meaning, what matters to you now moving forward. And, here are the areas that you can have some impact on your journey. And with that, once again, next slide. Thank you all for letting me address the human part of this. And I will, I believe, answer a question, right?